Platelet-rich plasma. This is something that's been in the press since about 2010 or so, when a member of the Pittsburgh Steelers was treated with it. Platelet-rich plasma is a derivation of a person's blood. The basic process is to take blood and use centrifugation and other processes to separate that blood into certain components in a concentrated way. In other words, you're taking certain things out of the blood, certain cell types, and you're taking some of the plasma out to concentrate it, and starting with this kind of volume and ending with this kind of volume to be able to inject into areas of the body to help it heal. Makes a great deal of sense. There are 500 plus different known factors within platelets alone that help the healing process. And when those are placed where they need to be placed, how they need to be placed there, it makes sense that that's going to cause healing of that tissue structurally. At OrthoCure Clinic, this is something that I've continued to do research on internally. I actually have in my lab the different testing equipment that I need to be able to hone down further and further and further on the best tissue grafts that can be created. Currently, that's a 5-step process that takes an hour and a half, and it ends with actually counting those numbers of platelets in the sample, so I can match that to the type of tissue that I'm working on, and it varies for nerves, fascia, tendons, ligaments, fibrocartilage such as meniscus. These all get different concentrations, and I can control that with the laboratory equipment and the trained personnel that I have. That makes ultimately a difference in somebody's outcome, typically in how many times I need to do a procedure. There's a great deal of talk out there of, well, I have the best this, I have the best that, I'm the best this, I'm the best that, this study says this study says that. I take all of that study information plus all of my personal experience plus the experience of about a dozen individuals that I have great respect for nationally, and create tissue grafts out of somebody's blood that is very specific for their condition. That's an uncommon experience, and what I just described to you shouldn't be expected by a typical provider. Nonetheless, it is the way that OrthoCure Clinic has, the pathway that OrthoCure Clinic has chosen to go down to create the best possible thing that we can for each patient, one at a time.